very much for joining us here on the NHS Grampian Facebook page. Although you can't see me, I'm Emma Pettis. I'm part of the communications team with NHS Grampian. We're here with Professor Amanda Croft, our Chief Executive, and Adam Coldwells, our Deputy Chief Executive. Thank you to everybody who's been submitting questions today. We're not going to be able to get through all of them in the short time that we have, but we've taken the questions and picked up some of the very key points. And Adam, if I could put the first question to you, a number of people have been asking us about what is happening with a staff testing programme and indeed a wider COVID-19 testing programme. So what can you tell us?
Yeah, thanks very much, Emma. This is obviously really important, and there's been huge coverage about staff testing and testing of the public and patients. So I'll just run through a couple of things that we're doing locally. We've got in place a staff testing programme which enables us to get staff back to work really quickly, which, as you'll all understand, is really critical at the moment. And that also allows us to test their families and people that live in their household. We had part of the challenge with this being a global issue, as we had a wee challenge over the last week with the reagent that allows the test to run in the laboratory. That's now resolved, and we're back up to testing at full scale. We've also got part of the national solution for testing starting at the weekend, and there will be a drive-through facility for staff as part of the whole government arrangement, and that will be at the airport. And I think really excitingly, we're getting up to being able to test 700 people every single day, and we're expecting that to double over a very short period of time. The next week or so, we'll be able to have double that every single day. Now, clearly it's really important as well that you understand about how we test the public and patients as well, and people who come into hospital are tested, and so all of that happens. And of course, it's important that we're part of a much wider community, and so colleagues who are in other critical services are also going to be able to be tested from next week. So that would include our colleagues in the police, local authorities, and all those other key players. So I hope that gives you some confidence that we've got a testing programme in place that's absolutely starting to run at full tilt and will really make a difference to how we can support people and how we understand the progression of disease locally. Thank you.
Adam, thank you for that. A number of questions that have come in, of course, regarding PPE. It's been a very hot topic all around this. Amanda, what update can you give us about the availability of PPE and how we're crucially getting this distributed out across the system?
Okay, thanks Emma. I'd just like to say thank you to everybody first of all for linking into this, and hopefully you'll find it helpful. In terms of PPE, we're working really closely with local suppliers and companies to bridge any shortfall we may have, and we're linking into the National Distribution Centre where all of our stock is kept for the whole of Scotland, and they link into the UK-wide distribution centre. Our top risk is that our staff aren't protected, so we're spending a lot of time on this. We've put a lot of resource around this to make sure that we know what stock we need, we know who needs it and when, and we know where to get it from. Now, you'll have read nationally in the media that this has been a challenge in some areas. We're well aware of that. We get daily updates from the National Centre, and we're doing everything we can to make sure that no member of staff, be they in hospital or community, are without the equipment that they need. Now, logistically, that is a real challenge. It would be wrong to say it isn't. However, a key risk is that our staff aren't protected, and we are absolutely doing everything we can to make sure that the stock is there and available when our staff need it. Thank you, Emma.
Adam, another question that we've had coming in has been around shielding. Lots of people out in the community getting letters advising them to shield because they may potentially be at greater risk. Some confusion about who should and shouldn't be doing this, and what might happen to people who've been asked to shield if and when any of the lockdown measures we have at present are eased. What more can you tell us about that?
Yeah, thanks. So the shielding's a really crucial thing as part of the overall programme of work and of social isolation and of keeping people safe. So we've written through a national mechanism to people who fit into 7 key categories who are deemed to be at a higher risk from the COVID-19 virus. So, for example, that's people who have perhaps had an organ transplant, certain types of cancer, people with certain types of respiratory condition. And so there are 7 of those bits, and you can find details of those on the NHS Inform website, and we'll put a link to that at the end of this if you need to get some help finding NHS Inform. So if you're in one of those categories, you should have had a letter that you would have received, and it would have told you about staying isolated, and including those close and around you, so your family and those people that live with you also need to support you in this isolation, and that's for a period of 12 weeks. So we need you to withdraw for that 12-week period. So regardless of what happens in the wider community and the wider sense of social isolation and the reviews that we've heard on the news that are coming up, we're really asking you to stay protected and on your own or with your family for that 12-week period. I guess, as Emma says, we understand there's been a bit of confusion. I'm really sorry for the confusion. We're just trying to tidy some of it up now and give you some signposts to help tidy it up for anything that I don't answer here. So, importantly, if you've been identified and you've received a letter, but you've not had any follow-up from us, so we're trying really hard to get in touch with everyone that's in one of these at-risk categories so that we can support you through this and give you some really personalised information about how we support you with your condition through this period. Or if you think you've got a letter and you don't think you should have got a letter, or if indeed you feel that you are in one of those categories and you've not yet received a letter, then we'd ask you to get in touch with your GP. So again, throughout this COVID period, the GP is still a really critical service for everyone and parts of our community. So if you're in one of those 3 categories, so you're needing a bit more support, you've got a letter but you didn't think you should, or you haven't got a letter and you think you should have done, please get in touch with your local practice and they'll guide you through that next immediate step. And as I said, use NHS Inform. That's a really helpful thing as well. So key messages are: stay at home for 12 weeks, avoid as much face-to-face contact as you can, make sure that's you and all of your family that are part of this system. And then the other thing that I haven't mentioned is we want you to sign up to the text service. So good old text on the phone is going to give some really key information for you, and that's detailed in your letter. Now, as part of that, you can get some really great tailored support from our partners and colleagues broadly run through the local authority, who are supporting lots and lots of parts of our community through this COVID period. So there's a helpline to ring, and again we'll post that at the end of this broadcast so that you can find a link and follow the phone number. Now that allows you to get priority shopping dropped off to your house, and other things that will really help you be supported. We're really conscious 12 weeks is an awfully long time to be on your own and to not be in normal day-to-day run of life. So we're trying to wrap as much support as we can around you, and as I say, a critical part of that is coming through our partners and the wider family of public service and some volunteers that are trying to help make this really work for our community through the coming weeks. So hopefully that tidies up a few things, and hopefully I've signposted you to 1 or 2 other things that will help you. But please get in touch if there's any confusion at all. We're really keen to work on this together. Thanks, Emma.
Adam, thank you. We don't have very much time left, but Amanda, I know you were keen just to get a general message out to all of our staff as a big thank you for their efforts.
Yeah, definitely. Probably before I say that thank you, Emma, maybe Adam and I can just highlight a public message that we will be putting out around how we're going to manage this situation and how we've had to change some of our services and why people aren't getting their operations as timely as we would have liked. So we will be putting something out in the next day or 2 to the public and to staff to explain what our plan is, what part our staff have had to play in that, and hopefully that starts to give people a bit more of an idea of how we're going to deal with this as an organisation, working with our partners in this unprecedented times. So I'll just finish by saying a huge thank you to all of the staff and all of our partners staff who are helping us throughout this. I'd like to say a particular thank you to the people that are helping us to plan this. I think often they're the face that people don't see. There's a huge amount of work going in. I think the guidance we're getting nationally is really supportive and helpful. And as you go around and speak to staff, which Adam and I still do on a regular basis because we think that's really important, the staff have just taken this on and they're getting on with it. And I'd like to say a huge thank you to staff for that. We've all got our own personal worries about this and how that might affect us, but I have to say I'm not seeing that when I go and speak to staff. All they think about is how we can support patients and the public through this and how we can do our best to keep people safe. And my ask of the public is please adhere to the national guidance, please stay home and please keep the NHS safe. Thank you, Emma.
Adam, Amanda, thank you both very much for your time this morning. We're going to close the broadcast there. We hope this has been useful for those of you watching. We are planning to do more of these with various other senior managers and people across NHS Grampian to give you the information that you need about how we as a board are responding to this pandemic. So thank you for watching and keep an eye on our social media channels. We'll let you know about who's coming up next.
Thank you.
Thank you.